When you hear people in the United States talking about healthcare, one of the names that often comes up is the Affordable Care Act, or ACA. Sometimes you'll hear it called Obamacare. But what exactly is the ACA? Why is it called Obamacare? Who created it? And what benefits does it really give to people? And how is it different from programs like Medicare and Medicaid? That's what we're going to explore in detail today. The Affordable Care Act was introduced in 2010 and signed into law by President Barack Obama. That's why it became commonly known as Obamacare. At its core, the ACA was designed to solve a huge problem in the American healthcare system. Before 2010, millions of Americans had no health insurance at all. Insurance companies could deny coverage to people with pre-existing medical conditions like diabetes, cancer, or heart disease. Premiums were often unaffordable, and many people simply lived without health coverage. This created a crisis where families were going bankrupt just because someone got sick. The ACA was meant to change that by making healthcare more affordable and accessible to everyone. So what does the ACA actually do? One of the biggest changes it introduced was that insurance companies can no longer deny coverage to people with pre-existing conditions. For example, before the ACA, if Sarah had asthma since childhood, insurance companies could simply refuse to give her a health plan. After the ACA, they are required by law to accept her, and they cannot charge her more just because she has asthma. This was a game changer for millions of Americans. Another major feature of the ACA is the health insurance marketplace. This is an online platform where people can shop for health insurance plans, compare prices, and get subsidies based on their income. Imagine it like an online store for health insurance where you can see all the available options in your state. If you are a low or middle-income earner, the government provides financial assistance to help pay your premiums, making insurance affordable when it otherwise wouldn't be. The ACA also expanded Medicaid in many states. That meant more low-income adults could qualify for health coverage even if they didn't have children. For example, in expansion states, a single adult with a very low income can now qualify for Medicaid under ACA rules. However, it's important to note that not every state accepted Medicaid expansion, so the benefits of ACA are felt differently depending on where you live. Now, let's talk about the benefits ordinary people get from the ACA. First, young adults are allowed to stay on their parents' health insurance plan until age 26. That means college students and young professionals who might not have jobs with benefits still have access to coverage. Second, the ACA requires insurance plans to cover preventive services like vaccines, cancer screenings, and annual checkups at no extra cost. This helps people catch health problems early before they become more serious. Third, the ACA put limits on how much money people would have to pay out of pocket in a year, protecting families from medical bankruptcy. For example, consider David, a 30-year-old freelancer. Before the ACA, he struggled to buy insurance because he had a past knee injury, which insurers labeled a pre-existing condition. After the ACA, he can buy coverage through the marketplace, receive subsidies to lower his monthly premium, and he doesn't have to worry about being rejected. For him, the ACA was the difference between living without coverage and finally having the protection he needed. But how is the ACA different from Medicare and Medicaid? This is where many people get confused. Medicare is a federal program mainly for seniors and some disabled individuals. Medicaid is a joint federal and state program for low-income people. The ACA, however, is not an insurance program itself, it is a law that reformed the private insurance market and expanded Medicaid. In other words, Medicare and Medicaid provide direct insurance coverage, while the ACA sets rules for how insurance must work and provides a marketplace for people to buy affordable plans. That's why ACA is separate. It doesn't replace Medicare or Medicaid, but instead it fills the gap for millions of Americans who didn't qualify for either program. It's also worth mentioning why it's called Obamacare. The law was one of the signature achievements of President Barack Obama's presidency. Opponents originally used the term Obamacare as a negative label, but over time it became widely accepted, and even President Obama himself embraced the name. Today, both ACA and Obamacare mean the same thing. Over the years, the ACA has faced criticism and political challenges. Some people argue that premiums are still too high or that the government is too involved in healthcare. Others believe it didn't go far enough in creating universal coverage. But no matter what side of the debate you're on, one fact remains clear: the ACA provided health coverage to millions of people who were previously uninsured. It reduced the number of uninsured Americans by millions and gave new protections to people who already had insurance. In conclusion, the Affordable Care Act, or Obamacare, is a law passed in 2010 to make healthcare more affordable and accessible. It prevents discrimination against people with pre-existing conditions, creates a marketplace for buying insurance, provides subsidies to lower costs, expands Medicaid in many states, and ensures that young adults can stay on their parents' plans until 26. It is different from Medicare and Medicaid because it's not a direct insurance program. It's a reform of the system that helps people access private insurance in a fairer, more affordable way. Whether you call it ACA or Obamacare, for millions of Americans it has meant one thing: the ability to get healthcare when they need it, without the fear of being left behind.